As an ulcer patient, there are certain things you need to take note of, which is lifestyle adjustments, and also, let me say it, in terms of diet, there are some things you need to adjust. Hello everybody, once again I am Morenke, and in today's video I'm going to tell you all you need to know about peptic ulcer. And also make sure you like, comment and subscribe to this YouTube platform. So let's get started. According to S-line, peptic ulcer is the sore of the lining of the stomach, small intestine or the esophagus, which is caused by inflammation of a bacteria known as Enterobacterial pylori and a stomach acid eruption. It can also be defined as a wound in the gastrointestinal tract that can cause pain and discomfort in all the general body, especially like abdominal pain, which can be due to like lifestyle factor like smoking, drinking of alcohol or using of certain drug, except from the bacterial causes. Now we have different types of peptic ulcer, like the duodenum ulcer. This is the one that affects the duodenum, like the upper part of the duodenum. We have the gastric ulcer, which is due to like poor diet intake and also high increase of acid in the stomach. And the last one is esophagus ulcer. This is the one that usually used to affect the esophagus, let me say generally the small intestine. Now the basic factors or the basic causes of this peptic ulcer is, one is lifestyle changes or lifestyle factors like smoking, when you skipped your morning food or you don't eat on time. These are the basic causes of this peptic ulcer. The next one is use of drugs like analgesic like ibuprofen, all these NSAIDs, all this kind of drug can actually trigger ulcer in the body. Now let's talk about the complication and the diagnostics. When ulcer, you do not treat it properly or you do not take care of it properly, because it can be treatable. Let me put it in that way. Don't let us call it curable, but it can be treatable. Now when you don't do it properly, it can lead to several complications like perforation, internal bleeding, also like some GIT disorder. All these things are the complications that when you don't treat peptic ulcer quickly, it can lead to. And one of the basic diagnosis of this peptic ulcer is endoscopy. Other people can use laparoscopy to detect it, but endoscopy is kind of common way of detecting the peptic ulcer. So what are the signs or symptoms of peptic ulcer? One is abdominal pain, mild headache, fatigue, loss of appetite, stress. All these things, and also the signs and symptoms of peptic ulcer: vomiting, constipation. All these things are the signs and symptoms of peptic ulcer. So what are the treatments, or let me call it the management of peptic ulcer? Take note of your lifestyle changes, like eating early, even before you get hungry. Try to eat. It's not until you are hungry before you eat. Food at least as a ulcer patient, like 8 o'clock at least you should be able to have eat your morning food. You don't have to skip your morning food at all. The next one is quit smoking. You don't have to smoke. If you ever want to drink alcohol, reduce it in intake. You don't have to drink too much of alcohol like that. And also I want you to take note of any analgesic or certain medication that you are using. Example like ibuprofen. If you see that you are a kind of ulcer patient, please take note of ibuprofen. You don't have to be using it like that. You can try to take another drug instead of that if you want to take any analgesic. And what did I mean by analgesic? Analgesic means a pain reliever. Then lastly, management too. Apart from lifestyle factors, if it's due to bacterial infection or bacterial inflammation, make sure you go to the hospital to go and confirm the kind of certain antibiotics that you can use to cure it. Example of the bacteria I'm talking about, or the common bacteria for this peptic ulcer is H. pylori. So this kind of bacteria, it is not due to hunger. It is actually due to a certain bacterial infection that you need to take a medication of it. Make sure you go to the hospital and don't do self-medication, because it is like, I'll take antibiotic. No, don't do that. Make sure that you go to the hospital and go for the best prescription that will help you to cure this peptic ulcer. I want you to take note of ensuring that you cultivate a healthy lifestyle factors in terms of nutrition or in terms of diet. Also play essential role in treating this peptic ulcer. So make sure that you eat enough balanced diet and stay hydrated. If you know that this video is very helpful to you, don't forget to like, comment and share. Once again, I am Renke. See you next time.